A dry cough, also known as a non-productive cough, is a cough that does not produce mucus or phlegm. It can be caused by various factors and can be quite bothersome due to its persistent nature. The hallmark symptom of a dry cough is persistent, often irritating coughing spells. These coughs tend to be frequent and can occur throughout the day and night, disrupting normal activities and sleep patterns. Individuals experiencing a dry cough often report a persistent tickling or scratchy sensation in the throat. This sensation triggers the urge to cough, even though there may be no phlegm or mucus present to expel. The constant coughing associated with a dry cough can lead to throat soreness or irritation. This discomfort may worsen with continued coughing and can make swallowing or talking uncomfortable. In some cases, the repetitive strain on the vocal cords from persistent coughing can lead to hoarseness or changes in voice quality. The voice may sound rough or strained, making it difficult to communicate effectively. Severe or prolonged episodes of dry coughing can cause temporary difficulty in breathing. Individuals may feel short of breath or experience wheezing, especially during intense coughing fits. The repetitive action of coughing can strain the chest muscles, leading to chest pain or discomfort. This pain may be localized or radiate to other areas of the chest and can vary in intensity depending on the frequency and severity of the coughing spells. Dry coughs often worsen at night, disrupting sleep patterns and causing discomfort. The reclined position during sleep can exacerbate coughing fits, leading to more frequent awakenings and overall poor sleep quality. Chronic dry coughing can be physically exhausting, leading to feelings of fatigue and lethargy. The constant strain on the body from coughing can drain energy levels and contribute to overall weakness. In rare cases, prolonged coughing spells may result in temporary dizziness or lightheadedness. This can occur due to reduced oxygen intake during coughing fits or from the exertion of the coughing itself. The most common cause of a dry cough is viral infections such as the common cold or flu. These infections irritate the throat and airways, leading to coughing. Allergic reactions to pollen, dust, pet dander, or certain foods can trigger a dry cough as the body attempts to clear the irritants from the airways. Exposure to smoke, pollution, or dry air can irritate the throat and trigger a persistent dry cough. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to coughing, wheezing, and shortness of breath. Gastroesophageal reflux disease can cause stomach acid to flow back into the esophagus, leading to irritation and coughing, especially at night. Certain medications, such as angiotensin-converting enzyme inhibitors used to treat high blood pressure, can cause a dry cough as a side effect. Conditions such as bronchitis, pneumonia, or whooping cough can cause a persistent dry cough as the body tries to clear the airways of infection. The treatment of a dry cough depends on its underlying cause. Some common approaches include hydration. Drinking plenty of fluids helps to keep the throat moist and can soothe irritation. Warm liquids like herbal tea with honey can be particularly soothing. Using a humidifier or vaporizer adds moisture to the air, which can help alleviate a dry cough, especially in dry climates or heated indoor environments. Over-the-counter cough suppressants containing dextromethorphan can help reduce the frequency and severity of coughing bouts. Using saline nasal sprays can help alleviate nasal congestion and postnasal drip, which can contribute to a dry cough. Avoid exposure to smoke, pollution, or other environmental irritants that can exacerbate a dry cough. If the dry cough is caused by an underlying condition such as asthma or gastroesophageal reflux disease, appropriate treatment of the underlying condition is essential for managing the cough effectively. If a dry cough persists for more than a few weeks, is accompanied by other concerning symptoms such as fever, chest pain, or shortness of breath, or if there is uncertainty about the cause, it is important to consult a healthcare professional for proper evaluation and treatment. With appropriate management, most cases of dry cough can be relieved, improving overall comfort and quality of life. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.